Hi everyone, welcome into my Chamber TV, the heartbeat of the Tampa Bay community. I'm Barbara Marville Kelly, your host. We are actually featuring Palm Harbor Chamber of Commerce today, and I've had the pleasure of speaking with Dr. Tuttle from Tuttle Healthcare. Get it? Tuttle Healthcare, Total Healthcare, because you do it all. I cannot wait for you to tell the niche that you've created for yourself, Dr. Tuttle, in chiropractic and some of the other things that you do actually at your facility. And you want to make this work. You've joined the Chamber of Commerce with Palm Harbor Chamber of Commerce. And I have to say, if you've ever been in a car accident, if you're suffering from any kind of chronic pain, and the list goes on, if you've never tried a chiropractor, or maybe you have and you'd like to change, this man is going to give you a lot of the bells and whistles as why to do that. So let's talk about chiropractic. What happens to our body when we get out of alignment?
Well, I mean, as time goes on, there are bumps and falls, even starting at birth. You have people getting forceps on the head and vacuum extractions and all these things. They get traumatized. It throws the system out of whack. And as we grow and mature, our system gets more ingrained in these patterns of dysfunction. And so, but that doesn't mean that at any point in your life you can't go in and make changes in the body.
Exactly. And so some of those changes through manipulation of the spine. Tell us a little bit about that. What actually happens? Because there's probably some of you out there that are maybe afraid to go to a chiropractor. Don't be. I've been a patient since 19.
And there's really nothing to be afraid of at all. And I do a variety of ways of doing the adjustment. Some people don't like the sort of classical chiropractic adjustment, which makes a little noise. They really have, and then they don't go to a chiropractor. I think that's silly because there's so much help that they can get. So I do things. I use wedge-shaped blocks that you place under the pelvis, and the body brings itself back into alignment. I use little instruments that go click, and it makes a little clicking noise, and it's just a little flick to make the adjustment. I do something where you stretch out the lumbar spine. It's called flexion distraction. I do that. I also do something called craniopathy, which is cranial bones. And so 80% of your nervous system is up here. You know, it's not in the spine. And so we're able to get a lot of really great results with that. And even in cases where people have tried chiropractic and it hasn't worked out, this is a specialization that really can get some results when people are otherwise not able to achieve them.
And when you talk about specialization, it's the techniques that you use.
So I use something primarily called sacro-occipital technique, which is named because of the relationship between the sacrum, which is at the base of the spine, and the occiput, which is one of the bones in the cranium. And so these two parts of the body, the cranium and the pelvis, need to be functioning properly for optimum health. And what happens is, just by existing in our universe through bumps and falls, and also just exposure to toxins and stress is huge. It will, throw your system out of whack. And one of my jobs is to help you get back as best functioning as you can.
Exactly. Sometimes it's not all that easy for us to de-stress, and we all know that we should be doing that. So sometimes we may need that little extra help, and you can do that through this manipulation process.
Yes, and I have 2 licenses, you see. So I'm a chiropractic physician, but I'm also a licensed psychotherapist. So when we talk about stress, before I ever was a chiropractor, I was just a straight talk therapist. And what happened was, as I worked with people, I got great results doing therapy. But there were these people who they were talking about their problems for 12, 15 years, and it just weren't getting better. So I started to look more at the physical components of what was going on. And chiropractic can help with that. And the other thing I do with that can help with that is called neurofeedback. And what that is it's based on the brain. So you have a lot of problems people have that are really brain-based problems.
Like what?
Like ADHD.
Okay.
Major depression. We're not talking about, your dog dies and you're just sad for a few days. We're talking about, I've been depressed for 30 years. Major depression, anxiety, any traumatic brain injury, obsessive compulsive disorder, post-traumatic stress disorder, epilepsy. These are all things that are brain-based. And so the way neurofeedback works is, what we do is we take a person, we all have a brain, and brains fire the neurons, and those neurons give off electrical signals that you can pick up on the head using an EEG. And this is a technology that's been around since the 1930s. So you record the EEG, and then you compare a person's brain function to that of people who don't have any major problems. So they don't have ADHD, they don't have a traumatic brain injury, they don't have depression, etc. And we see what areas of the brain are dysregulated. And then if an area of the brain that is dysregulated matches the symptoms a person's having, then we know we have something that we can help them with, most likely. So, for example, if a person has ADHD, we're going to look in the areas, the attention network. It's a whole, these different parts of the brain that work together to help you focus and have attention. A lot of it's in the front, some of it's in some other locations too. We want to look and see if those areas are affected. Then what we can do is go ahead and retrain the brain to not do those dysfunctions.
Not do that.
Yeah, it's like, hey, don't
Stop
do
it.
that. No,
Right.
Don't do that. Because it, like I said, we just get, everything's just a series of patterns that just get locked in. And so what we do is just help a person retrain their brain.
Yes.
And we take baseline measures, we see what's going on, and then we retest. You know, we do some sessions, and then we say, okay, where are we at now? Do we need to do more, or are we done?
Yes. Yes.
And we get great results with that.
So, and I know you can't really give exact numbers or anything like that, but what are we talking to? Because, you know, everybody gets different results. For somebody that might have a particular issue, what are you finding in your practice as a pretty good test case as far as helping and assisting through your methods and your kind of niche neurofeedback? In the practice in general, yeah. So if we have somebody who comes in with a problem like, you know, like let's just say ADHD, because I have a pretty robust success rate at treating that, have presented that at research conferences. The person comes in, you know, we take these measures, but I'm going to do, if the patient wants, I would prefer to do the chiropractic piece and the neurofeedback piece, because they can work synergistically together. Yes.
There's some thoughts that the chiropractic sort of primes the nervous system for the change, and then the neurofeedback goes in kind of specifically and just kind of, you know, gets at the issue.
Yeah.
You know, and so, you know, go ahead. No,
I'm just so fascinated. I just love listening to you talk because I'm so fascinated with the brain.
Yeah.
And, you know,
the brain's very big these days.
Exactly.
Yeah.
And the thing is that if you think that, like, maybe you've been diagnosed with something, do you ever stop to think that there are things out there that just might help you, and it's a matter of education? Yeah. Now, you've given me a list of things that I've never heard of before, and as far as how you're really helping people, even anxiety, and we've only got a couple of minutes, darn, but also autism.
Yep.
Right?
Yep. Autism's complex. Now, I'm not going to go and tell you that, you know, you're going to come for 10 sessions of neurofeedback and I'm going to cure you of autism, right?
Right.
But autism can be very helpful. Neurofeedback can be very helpful for autism.
Okay.
Again, the attention part. Autism needs a team approach, and you need a lot of therapies for it. But chiropractic, neurofeedback are two of those things. And you know, if you're working with other providers, be they medical or in the holistic field, I'm always happy to work with whoever to find the best fit for you as a patient. You really love what you do. Yeah. I can tell. I wouldn't have gone for all that school if I didn't. I can tell. This is awesome, and you've joined the Chamber. You're a brand new member? Yeah, I am a brand new member, and the Chamber has been very, very supportive, and it's a good bunch of folks. I really actually enjoyed my time there. Oh, that's great. You're gonna love it even more the deeper you go into getting involved in the community. Well, Dr. Tuttle, I want to thank you very much. You're going to see me at your office. I can promise you that. Oh, good. And think about it, your location is in Palm Harbor, right off of Tampa Road and US 19. Yep. So it's easy to find. I love it. Tuttle Health. Get it? Tuttle Health. You can go there for a number of different means of help, and I'm sure Dr. Tuttle would really love to meet with you. Come in for a consultation. Give him a call today. Don't wait, because hope is here, right? Sure.
I'd love to hear it.
Yeah, absolutely.
Well, congratulations and thanks for coming on the show.
Thanks for having me. It's been a pleasure.
All right. We're going to have you back. I know we are.
Okay, I look forward to it.
Stick around. We're going to come back after these messages with more great guests with the Palm Harbor Chamber of Commerce.